For many of us, a trip to the dentist is routine, but for others it can feel intense. It can bring up fear and discomfort, especially if they've experienced trauma or assault. The good news is that dentistry is evolving to meet these unique needs. Now, if you're thinking this topic doesn't apply to you and that it's overkill to think about the dentist in these terms, you should definitely keep watching. Because the more informed you are about what you can and should expect at the dentist appointment, the more you can control what you receive by asking for it. So stick around to learn how trauma-informed care is transforming dentistry into a safer, more inviting space. Imagine being in a vulnerable position, lights glaring, tools in your mouth, and unable to speak. For those of us who don't think of ourselves as trauma survivors, a trip to the dentist is not fun, but we manage. For trauma and assault survivors, it can be overwhelming and even re-traumatizing. Many survivors avoid dental care altogether, which leads to long-term oral health issues. So thinking about this, answer this. Have you ever felt uneasy or overwhelmed at the dentist's office? Let us know in the comments below. The good news is that dentists are realizing that what's routine for them may be deeply triggering for their patients. More and more dental practices are embracing trauma-informed care, which means they're prioritizing patient comfort and safety over efficiency. What do you think of this? Do you think trauma awareness should be a part of a dentist's training? Well, to help you answer this, let me tell you a bit more about what we mean by trauma-informed care. Essentially, it's about understanding how trauma affects the body and mind. In dentistry, this involves simple but effective strategies, like explaining each step of a procedure, offering choices, and allowing patients to control the pace. Now, when I think about my last few appointments, I notice how my dentist did in fact explain things as we went along, and checked in to see if I was okay throughout the appointment. Now that I think about it, it was one of the things I appreciated, and it made the next trip less dreadworthy. So if you could design the perfect dental appointment, what would it look like? I'd love to hear from you. You can also share what hasn't worked so well for you so that any dentists who are reading might learn from us. Also, did you know that some dentists now allow patients to bring a support person to appointments? And some will even use calming techniques like weighted blankets or create physical spaces that feel less clinical. Small changes like giving patients control over when a procedure pauses can make a huge difference too. I remember this was an option for me when I had a procedure in recent years. What about you? Would these adjustments make you feel more comfortable at the dentist? Do you think they're necessary? From my perspective, I think educational programs that are being developed to teach dental professionals to recognize and respond to trauma cues are a great idea. Why? Because the dentist's office is a place in which most of us are already feeling apprehensive. We're giving over a lot of control to our dentists, something we humans hate to do on a good day. And on top of that, we're allowing them to do things to our faces that are incredibly invasive. There's a lot of trust we actually put in our doctors, dental or otherwise. And I think training that emphasizes empathy, communication, and patience are going to be good for patients, not just survivors. I'd love to hear whether you agree and why. Yes, I have heard from my clients that they have experienced a huge difference when their dentist has adopted trauma-sensitive techniques. From finally addressing years of dental pain to feeling genuinely cared for. It's been quite profound for some of my clients. Remember, it's not just about the teeth, it's about restoring trust and dignity in healthcare. And it's what we should expect. Let me know if you think a dentist is becoming more patient-centered. And if you don't know, because you avoid them, then maybe now is the time to reconnect with them. Who knows? Things might have improved. This movement toward trauma-informed care makes such a difference, and not just for survivors of trauma and assault, but for everyone. If you found this video helpful, please give it a thumbs up and share with someone who might benefit from a trip to the dentist. And don't forget to subscribe for more important info like this.